Howdy, folks, and welcome back to Healthy Humor. I'm your host, Doc MB. If you noticed, we haven't had an episode in a couple of weeks, and that is because I had a family member actually go through a pretty serious medical emergency, and I have been helping take care of them. They actually are still in the hospital, which means that I've spent a lot of time at the hospital in the past 2 weeks, which has given me all kinds of inspiration for episodes to get out, including this one. Today we're going to talk about person-first language and why it's so important. So person-first language would be something like, uh, you know, the person experiencing schizophrenia rather than saying the schizophrenic over there, right? Or maybe you went into the hospital or your regular doctor's office with a broken arm and you just keep hearing them referred to you as, oh yeah, the broken arm in room 3. Well, that doesn't feel great, right? Like if it was me, well, I'm Mary Beth, and I would want them to say, oh yeah, Mary Beth with the broken arm in room 3, because it's something that is happening to me. It's not who I am. We all have different things in our lives, right? You could be a parent, you could be a teacher, you could be a content creator, you can be a writer, a creator, any number of things, right? But they're all just pieces of the whole, and you are the whole. And you don't want to be referred to as just the one thing. Just like in medicine, we don't want to refer to patients as just the one diagnosis or just the one issue that they are going through. In the case of my relative, my family member who is in the hospital right now, we had a member of the nursing staff to our faces tell us that it didn't matter what that person's motivations were or how to motivate them to, heal, because what their injury was, that their injury healed on its own timeline, and that's all it was, and that's what they were, was that injury. And it really upset me as someone who is quite literally educating students to not do things like that. But for my family members who don't have the same background, it was still upsetting because they kind of felt like this other family member was being just pigeonholed and that they weren't being considered as themselves. And it was really frustrating, especially then when we turned around and told that family member about it, because the type of injury that they went through and everything, and this happens with all kinds of injuries. But their pride was kind of hurt, and they were already feeling that. And then to have their identity kind of disregarded once they were in the hospital was not a great feeling. I was able to, I'm very good at self-advocating, as we've talked about before, but I was able to go to a manager on the nursing staff and, get my complaint in that way. So if you're ever in that situation, it's easy to find a manager or to find someone who is willing to listen, especially because while medical care is medical care, there is still a degree of, the client's always right, right? The customer's always right. Well, the patient isn't always right, but the patient should be treated with that same level of respect, and we need to listen to them and pass things on. And hospitals want to do well too. This is, we've talked before about patient satisfaction surveys and things like that, and this is where that comes into play for them. So they want you to feel like you're being listened to, on top of the fact that there have been studies that show that using person-first language and treating patients as a whole actually increases improves health outcomes, but it increases patient satisfaction scores, which hospitals get graded on, and then that happens to influence their funding and things like that. So they do care about that, regardless of the fact that they should just care about it anyway, because we are people. We are all people. Something that you can do to really help with this is, if you're the provider, obviously don't refer to your patients as whatever their diagnosis is or some other factor. Just refer to them by their name. It's like, yes, you get busy. I get it. But you're looking at someone's chart as soon as you walk in. And if they're in inpatient care, most of the time they have their name written on a board somewhere. Just be nice. It doesn't take that long to look down and say someone's name rather than just walking and immediately starting to talk to them. Introduce yourself, be kind, listen to them. You might be in a hurry and you got to get out. Okay, fine. patients, which are most of the listeners to this show, things you can do. It's this very similar to the advocating episode, um, speaking up, making sure you're asking all of your questions and that they're getting answered and that you're writing things down. But, introduce yourself to them. If they start talking to you and they haven't introduced themselves or didn't call you by your name yet, stop the conversation. Introduce yourself, make them introduce themselves back. I know this can be kind of daunting if you're not as type A and aggressive as I can be, but you're in the hospital. They don't know you from wherever. This is the time to act like you're a different person if you need to, and advocate for yourself. Or have someone there to advocate for you. Have someone there to stop the conversation and make sure everyone's being respectful. There's a lot of things that we talk about, like movement is care, food is medicine, all these little phrases, but language is part of caring. Absolutely. It may not be care, but it is part of caring. And the way that we talk to people is part of that for sure. So all this to say, the way that we refer to patients, the way that we are referred to as patients, while it may not always immediately affect us and cross our that barrier of, okay, this is my feelings here on this issue, and then this is how I maybe really feel. It may not always cross that, but it is part of the way we are cared for and the way that we experience medicine. So no one wants to be referred to as, I'm just this piece of my greater whole, right? I'm just a broken ankle, or I'm just a diabetic, or I'm just the person with heart disease, whatever. At the end of the day, I am who I am, and I want to be referred to that way. So if you hear something like this going on, you could stop the conversation and say, hey, I know I have this injury. Like if they said, maybe you overheard them in the hallway, or maybe they said it to your face. Stop it, call out, whatever you need to do. Because this is part of advocating for yourself, but also on the flip side, it's part of good care. So if you're not receiving good care, you should be. And it's perfectly within your right to go stand up for yourself and tell someone that someone else said something that hurt your feelings, or that made you feel like they weren't maybe giving you the best care, or that they weren't going to be giving you the best care moving forward. So remember, you're not your diagnosis. You are more than just whatever box got checked on a chart. And sometimes we have to be the ones to say, call me by my name and not by my diagnosis, please. I hope that everyone is staying happy and healthy. This has been Healthy Humor.